The last years have been marked by COVID-19, which had an impact on all people. However, UN Secretary-General António Guterres pointed out the gender-specific differences between women and men. Early data indicates that the mortality rates from COVID-19 may be higher for men, but the pandemic is having devastating social and economic consequences for women and girls. Based on the assumption that country, society, socio-economic conditions and similar factors affect people differently during the pandemic, the studies conducted by PandeVITA have shown that the actions taken during the pandemic affected women and men differently. Responsibilities and obligations that social life entails, as well as duties and tasks in business life, are different for the sexes. The topics of health, women's employment, family life, and various social problems that women faced during the pandemic were researched. In addition, new policies to promote women's employment and to strengthen their social status in society were discussed through the participants' studies and experiences during the pandemic period. During COVID-19, the social situation of women had become worse. According to a study by the UN Women on Rapid Gender Assessment Surveys, cases of domestic violence against women has increased because of the lockdown. Worldwide, 245 million women and girls aged 15 or older have experienced sexual and/or physical violence by an intimate partner in 2020. Furthermore, the report showed an increase in health complaints. More than 2 in 5 women reported that their physical, mental, and emotional health have been negatively affected as a result of the pandemic. Women also faced major challenges in terms of workload. While sectors such as trade and manufacturing offer flexibility to employees and employers, the occupational fields in which predominantly women work could offer less flexibility and resulted in additional workload as well as difficult tasks. According to a gender report after COVID-19 of the Committee on Women's Rights and Gender Equality of the European Parliament, more women than men in the youngest generation worked in home offices during the pandemic, resulting in female employees taking on a disproportionate amount of unpaid work. The proportion of women working in the home office was higher in households with children, especially single parents, in order to reconcile family life and work. Furthermore, mothers working in the home office are more likely to be interrupted by their children than fathers, which affects their performance and can reduce their career advancement and pay, leading to gender gaps in pay and pensions. The share of female population aged 25 to 34 living in extreme poverty increased from 10.7% in 2019 to 11.9% in 2020. In 2030, the share is estimated to be 11.6%, so that employment activity will not reach the pre-pandemic level for the time being. PandeVITA developed several policy recommendations to improve the situation of women due to the pandemic. To ensure an important first step in the right direction, communication channels specifically designed for women should be created. In addition, low-income households should receive psychological support. Measures should also be developed to promote the formal employment of women. Gender equality is not only a fundamental human right, but a necessary foundation for a peaceful, prosperous, and sustainable world.